For at least 6 months, Blair Caniff was stuck in an Edmonton hospital hoping to get into a care home. Then he says a social worker told him he was moving.
They just told me I was going to a facility for long-term care.
Were you just told this is where you are being moved to?
No list. This is where you were going.
He says he was taken to a hotel south of the city. And what did you think when you first got there?
It was sort of a joke.
Recovering from a stroke, Caniff uses a wheelchair and is paralyzed on his left side. He called his wife for help.
I asked him, is it all fixed up for wheelchair users? And he said, no, it's just like, I said, it's just like a motel.
Has this travel lodge been turned into a long-term care facility? A hotel employee told CBC News no, it was a hotel with rooms that anyone can book, and that an organization had rented up to 10 rooms for several days. Caniff says a healthcare worker checked on him a few times a day, but he was otherwise on his own.
I needed proper care, being cleaned up and fed right. We were fed fast food.
If something happens to his good arm, then he would become totally helpless.
Caniff says Contentment Social Services was the agency running the program at the hotel. CBC News texted, called, and emailed the listed nonprofit multiple times, but no one responded.
I've never heard of that happening in Alberta.
This researcher who studies aging is shocked by the move. She says for patients with complex needs, a hotel stay could be dangerous.
He could develop a bed sore. He could fall out of that wheelchair and break a hip, break an arm.
Alberta is dealing with a growing aging population and hospitals are overcrowded, a problem acknowledged by the Premier this week.
There's a percentage of patients with more complex needs who remain in hospitals much longer than necessary.
No one from Alberta Health Services would speak on camera. In a statement, a spokesperson says different discharge options are considered for patients, and AHS works to connect patients with community nonprofits following discharge. Caniff says he was sent back to hospital Monday with no explanation, 1 week after he arrived at the hotel. He's unclear what will happen next.
It was a terrible situation.
Julie, do we know of other cases like this in Alberta?
So, Ian, I spoke with another patient who says he was also taken to a hotel after being in hospital. Now, AHS won't answer specific questions about whether a hotel is an appropriate place for a patient with high care needs, but it does say that care teams work with a patient and their family to prepare them for discharge. And options include lodges, emergency shelters, and short and long-term rentals.
Julie Wong with our exclusive story in Edmonton.